Continuing from last week's episode on alcohol use alongside Dr. Bonface Chitayi, on this episode we are discussing alcohol addiction and its management. Welcome to Focus on Health, a show on all matters health, wellness and lifestyle. I am your host Joy Bofenda, and before we dive into this very interesting topic, let's take a look at the health updates. So, Dr. maybe tell us, who is an addict?
So addict is the word used on the street for someone, in reference to alcohol, is someone who has also been called an alcoholic. These words are very negative, almost derogatory. They can also imply some form of discrimination or attract some form of discrimination. Therefore, in hospital, we don't generally say this is an addict. For us, they are patients. So they are patients, persons recovering from an alcohol use disorder. So alcohol use, a person who has been using alcohol and has been diagnosed to have an alcohol use disorder could be in any stage. Either they are still using actively, they could be in a rehab, they could have abstained for some time. But you see, for alcohol is a chronic and relapsing disease. So if they have not used alcohol for 3 months, we say they're in early remission. If they have not used alcohol for 12 months, 3 to 12 months is a sustained remission, and so on. So basically, it is someone who, or if they're in a rehab, they're in a controlled environment. So basically, these are, for us, they are patients. So it is, but the word is used to imply that someone is dependent on alcohol, and dependence usually has a number of characteristics. So I'll answer the question that whom can we say is a person who is dependent on alcohol use, or at what stage do we say someone has a disorder, rather than just normal use, everyday use. See, rather than someone who takes alcohol during weddings. Yeah. So alcohol use disorder usually has a number of characteristics. One is that the person loses control. That's one characteristic. So how does one know that they have lost control? Because they are trying to cut down the use of alcohol, but they're unable to cut down or to stop completely. And sometimes they go on to make declarations that they have stopped drinking to their friends or family, then they go and drink again. So that is someone, if the person is doing that repeatedly, they are losing control. Someone who continues to use alcohol despite the fact that it's causing them very painful consequences. If we hear stories that people who suffer from alcohol use disorders say, you might sympathize with them, yeah, because some of them have used alcohol for fees, for school fees. Some of them have been arrested by police. Some of them lose money. Some of them develop physical illnesses. Some of them separate with their spouses or abandon their families, or they are unable to fend. Some of them lose jobs, really. So they go through painful consequences of using alcohol, but in most cases, they will continue using alcohol. 3, somebody can neglect the other important things in their lives to continue and prioritize alcohol, So it's called the salient use of alcohol. Salient meaning that alcohol becomes the most important thing in a person's life. So they stop going to work, they stop engaging in hobbies, they withdraw from family engagements and so on. That is, and that's because they are giving more time to the alcohol use. The amount that the person is using keep increasing with time, and then experiencing withdrawal effects when you stop taking alcohol, and feeling guilty about the use of alcohol, feeling angry when people tell you about, criticize, because family members will always criticize somebody, tell you, no, you are drinking too much, you got into this trouble, into this sort of trouble, we bailed you out, you know, you need to stop drinking. The response is usually angry, an angry response, you know. So if some of these are present, you actually need just two to be present over the last 1 year for a person to be said to have an alcohol use disorder. But basically, if you are noting some of these patterns of use of alcohol, then it is likely that somebody may have an alcohol use disorder. Again, it's important that you consult a professional, such as a psychiatrist, to actually make that diagnosis.
Maybe, Daktari, what if a person only drinks 2 times in 6 months, but during those 2 times he cannot really control the amount he's drinking? Will you label him a person who has alcohol use disorder?
Okay, so that's interesting. I mean, there'll be some circumstances when maybe someone cannot fulfill the whole criteria that is written in books, but visibly this person is experiencing challenges. So if it's one is in 6 months, maybe the person takes large amounts of alcohol and they cause a lot of trouble, and next year also, after 6 months, they do the same. There could be a reason why this person is engaging in this kind of pattern. It's not normal, Yeah, causing disruption, chaos. You know, alcohol also, one of the reasons why people drink is to reduce anxiety. They reduce. So if your anxiety goes down, you find that it becomes easier for you to confront people, yeah, and ask them tough questions. So some people knowingly take alcohol so that they can address some issues in their lives. So, you know, such a person needs to be assessed. Maybe they have anxiety. So these are issues that they could be dealing with, but maybe they let them accumulate. Another reason why people drink is problems at work. So maybe your boss stresses you, but after some time, you can't take it anymore. So you go and drink and now confront them, you know, and you are ready for a fight, but after some time. So it could be that there's another problem, yeah, that is causing people to have that pattern. It may not be, alcohol may not be the problem, but there could be another problem. It could be a problem of their personality. Maybe they need to learn some assertive skills to establish their boundaries in the place of work, at home, so that they can live healthier lives. So, but that is a flag, you know, when someone has this pattern that is abnormal, even if it is after a long while, or, you know, even if they drink after a long time. Okay. Yeah.
So what are the risk factors other than genetics that predispose people to alcohol use disorders?
Okay. So, culture. Culture can be a risk factor. So if, for instance, you have peers who drink, you know, then they can influence you straight away. It's one of the common reasons why people actually start in the first place. It can be religion also. So there are religions that allow drinking and others that prohibit drinking. So that could be another reason. Then issues like personality disorders. So different persons have different ways they experience the world and they react to others, and that's called personality. So there are some personalities that are found to have, to have high risk for alcohol use. One of them is antisocial personality disorder. So this is the kind of people who break society's rules, who infringe upon the rights of others, you know. So they are violent, they can beat up other people, they can steal, they can lie, and most of them end up in prison. And they drink a lot, you know, and they can be charming. So antisocial, sometimes they are called psychopaths, you know. So if there's such a personality, to whatever extent, it can be a risk. Professions that expose people to alcohol can be a risk factor, such as working in a bar or restaurant that is selling alcohol. Brewing. So if somebody's profession is to brew alcohol, they're at a greater risk. Professions that are painful, in their nature or they're traumatic, such as being a police officer, being in the army, also being in the health profession. Yeah? These are painful professions, being a firefighter. So they lead to a greater risk. Also, if your profession is paying you very little, yeah, you'll become frustrated. Yeah? And going with that is frustrations at the workplace. So some people start drinking because of frustration in the workplace. Family. Yeah. So apart from genetic, there is also what we call modeling. So seeing that people in your family are drinking can be a risk factor, especially a parent. So because there's what we call modeling. So you can learn from there. But also family in terms of dysfunction in the family. So if you're coming from a broken family, you can end up drinking. So there are people who start drinking, for instance, because of divorce or separation. So it's a real risk for people to start drinking. But also family in terms of trauma during the early stages of development. So when you are very young, there was a lot of fights in your home. Your parent used to beat you thoroughly for small reasons. You may end up now drinking as an adult. So if you went through all these challenges. So, I mean, those are some of the reasons I can think of, but there are many reasons why people start drinking. But what is important for all of us to appreciate that for many of the people who drink, yeah, for many of the people who drink or who find themselves with alcohol use disorder, it is not necessarily a choice.
We're taking a short commercial break, but before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We are discussing alcohol addiction and its management alongside Dr. Bonface Chitayi.
A very bad childhood, it's not something that they are in control of, you know, and now maybe they have anxiety because of that, and now they started drinking to try and deal with that. So, and they find themselves they are dependent on the alcohol. It is not a decision that they are making on a day-to-day basis.
Okay, so Doctor, before we mention the support, you also mentioned about withdrawal. How can we tell that a person is withdrawing, if that is the correct term?
So it's always good to assume that someone will withdraw. Yeah, it's a physiological process. And alcohol is a depressant. When it is in the brain, when you put it in the brain from time to time, you press down the brain, and so the brain is used to that new state. So when you lift it, the person becomes hyper-excited. So the systems go haywire, and you find someone has tremors, sweating, nausea, vomiting. So for a person who has been using alcohol for some time and they stop, whatever symptoms they experience that are negative, that look like disease, it's always good to assume that they could be withdrawing. Withdrawal, again, is a technical area of disease that can only be diagnosed by a specialist. But you can suspect if someone is having nausea, vomiting, sweating, and tremors, headache, and sometimes convulsions or hallucinations, seeing things that are not there after using alcohol for some time, you can assume that they could be. They'll not all have all of them, but if they have one or two of those symptoms, they could be withdrawing, and there's treatment for that.
Okay. And also I've heard that during the withdrawal process, they might end up being psychotic. Is this true? And what period of time do we expect psychosis?
Yeah, so psychosis will vary from person to person. Not everyone, while withdrawing, they'll get psychosis. Some will get. Again, also, you know, psychosis is also an aspect of a human psychological disposition, you know. So probably people are at different risks. So from my experience and with my thinking, probably psychosis happens in those who are who could also be predisposed to psychotic illness, or those who have ever gotten psychotic illness, because not all patients who are withdrawing get psychosis. It can happen anytime during the period of withdrawal. A lot of withdrawal happens anytime between when the person stops drinking, maybe from 6 hours later to 48 hours. So anytime between that, there may be psychosis. It may happen later also. It can happen. This whole period of alcohol withdrawal can go even up to close to a month. Okay, it can all be a period of withdrawal. So it's important that people be on the lookout, but also we should be armed with knowledge that if someone desires to stop drinking, or we are trying to ask them to stop drinking, it's not good for them to stop suddenly and without advice from a professional. For instance, you come from Mukurweini, yeah, and your uncle drinks, and you're trying to help them. Yeah? The best thing is not to go and tell them to stop drinking and you'll give them some money. They will die. Yeah? So alcohol withdrawal can actually kill. So the best thing is say, let us go to Mukurweini Hospital so that you can be given some medicine to help you stop drinking. That is the safe and responsible decision to take.
So what if a person is not able to acquire healthcare services? How best can you support a person who is experiencing withdrawal symptoms at home?
Okay. So, I mean, it's unfortunate that we can talk about inability to acquire healthcare services. I think healthcare is a right, according to our constitution. And all public hospitals are designated mental hospitals, and these services should be available. So even support should be availed, but services should also be availed. So when you talk about with people who have alcohol use disorder and other substance use disorders, we always tell them that there'll be various levels of support. So there'll be yourself. You are the biggest form of support for yourself. Yeah, you have to make the decision, yeah, that you want to change. Number two, there is the family. So family has to be supportive. They can help you, take you to hospital, advise you, help you adhere to treatment. Number three is the health facilities. Health facilities must be functional. There must be health professionals in the picture. I don't see a way in which a large number of people, it may work for one or two people, but I don't see how it can be a strategy to say that we can manage alcohol use problems without hospitals. We need hospitals because detoxification can hardly happen out of hospital. So what we should say is that let all these things work. Let the person, at a personal level, individual, family, hospital. So if hospitals are not working, I think it's important to say that those responsible for them to work should do their job. So yeah, we should not patch it up. But still, even if hospitals work, family should still be there. Yeah, family should still be there. So what is the best way a family can support someone with alcohol use disorder? I think it's very frustrating for some. I've also met patients who have been in rehab 5 times. And each time they pay bills of over 200,000, and they feel tired, with this person. So for such, I think it's very difficult. Sometimes you don't have an answer for them. Sometimes we say that let us wait for an opportunity to arise, and then we can step in, or you can take action. There are people who they stopped drinking because they were going to lose their jobs. It's an opportunity. Okay? There are people who stopped drinking because they were arrested by the police. They went in front of the judge. Then the judge said that I'm releasing you, yeah, I'm releasing you only if on condition that you go to rehab for treatment. It's another opportunity. All right? So sometimes it is the painful experiences that arise from the use of alcohol that can become a turning point. And sometimes it's good to await for those opportunities, especially in serious cases. But where this person, but what is universal is that we should try to seek treatment for them. Okay, there are many people also out there who would not consider alcohol use as a disease. They think it is a person's decision, a bad decision, and so, you know, you should in a way be punished or discriminated or something. But truth is, these people, we should give people a chance, you know. So there are people who, when they're taken for treatment, even the first treatment, they will improve. Yeah. So also let us not over criticize people because of alcohol use. This again, as I said, that because it is seen as a habit, maybe the person began drinking by themselves, so people think that, okay, for this habit, you know, you should be punished. So they are discriminated and so on. They need to be given a chance, even at the workplace. You know, work is another form of family, and school as well. You know, so even if it's at work or at school, people should be supported. They should be given a chance. They should go for rehab. They should be given those 3 months. They go for rehabilitation. They come back. They continue their job, and they are welcomed without any form of discrimination. So these are some of the ways, Joy. Yeah.
Okay. So you've mentioned rehab. What exactly goes on in rehab for a person with alcohol use disorder?
Okay. So rehab is residential or inpatient treatment for alcohol use disorders. Another form is outpatient. So there are people who are treated as outpatient. For instance, you come, okay, probably your dependence is moderate. You don't have many of the symptoms. You have a few. You want to change your ways or your lifestyle. So we put you on some treatment. We can give you some medication to take at home. You are very well motivated. You have good family support. Yeah, you can be coming every week to do some activities in the hospital, you know, to get psychotherapy and so on. Inpatient is for severe. So maybe someone has been trying, maybe the outpatient was tried and it did not work, you know, or somebody needs some form of intense treatment. So what happens is that, one, there is detoxification. Yeah, detoxification is keeping you away from alcohol and giving you some treatment so that the body does not overreact. So whatever is given has some action similar to alcohol. It's also a depressant. So whatever we give is also a depressant. We give it to you so that you don't overreact and then they don't experience those nasty withdrawals. Number two, what happens is there's also treatment, medical treatment to prevent craving. A lot of people drink because they are craving, you know, strong desire. And when they are out there, one problem is what is called cues. So the brain learns that this alcohol is good. So that's one. So alcohol is taken because of whatever good it brings to people, either making them euphoric, happy, or reducing some negative things like anxiety. So the brain learns this is a good thing. So what happens is that you start associating alcohol use with many things, such as the road you use, the time of the day, your friends, and so on. That's why a lot of people will pass by a bar. They were not planning to get into the bar, but the fact that they have passed by a bar, they'll enter the bar and they'll stay there for 2 days. Okay? So inpatient treatment helps people to get away from the environmental cues for drinking, those triggers that make you drink, away from your friends and so on.
Very elaborate conversation we've just had, and just as Daktari has said, it's easier not to start than trying to quit. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy. I'll leave you with the Healthy You segment.